Hello, and welcome back to the STEM POV. This is our third episode, and for those who are just now starting to watch our podcast, our goal with this podcast is to provide reliable and accurate information and statistics on the deadly and highly contagious virus gripping nations around the world, also known as COVID-19. As the virus has continued to spread with more patients flooding your local hospitals and clinics, many health workers have been tirelessly combating the virus to help the millions of people who have been infected. Doctors, nurses, surgeons, they're working hours and hours trying to follow the strictest of the procedures to keep themselves safe while still working days on end. Many people are wondering if there's ever going to be a cure for this horrible disease. Now, I'm sorry to tell you if there's not a cure yet, but there are many ways to treat and slow the spread of this contagious virus. That is our topic for the episode today, taking a tour through the procedures and methods to slow down and possibly eliminate the virus for the people in the middle of this pandemic. Like always, I think it's time to introduce my co-host, Vamsipati.
Thanks, Srikar. I think this is going to be a very important episode for everyone, including ourselves, as many people aren't aware of a lot of methods to treat and slow down the spread of this infectious virus. But what we do want is to spread awareness.
Yeah.
So I think it's time we let our speakers take it from here.
Yeah, for sure. So our two speakers today are once again reappearing for episode 2. So everyone, please welcome Carreon and Middela.
Thanks, Srikar and Vamsi. So today's episode is more of a list of information, as we have many tips and tricks to help treat COVID-19.
Right.
So I'll be focusing on helping your systems, while Dale will talk about slowing the spread of the virus to others.
Got you.
In these times, you want to make sure that you increase your vitamin C intake to help the body's immunity and closely monitor any symptoms that may appear.
Okay.
Along with vitamin C, you want to make sure that you increase your calorie intake, which, in my opinion, won't be so hard since we're all raiding the pantry like every 30 minutes anyway. Before we get into actually helping the symptoms, I'm going to give some other small tips.
Okay.
So, heat can actually kill the virus. This is partially why we see lower cases in hotter regions of the world.
Got you.
Now, we all know the risk of ordering takeout, but come on, we can't ignore that amazing food out there forever. But when you do buy food from the outer, unfamiliar, and alienic regions outside your house, make sure to heat your food so that if there are small traces of the virus, it gets eliminated.
Gotcha.
I think I'll let Dale take over from here.
Whoa, those are a lot of tips, Sri. But they'll definitely be worth keeping in mind so my family and I are safe.
Yeah.
Me too.
Now, if it ever gets to the point where you or anyone close to you contracts the virus, I'm going to explain why you would need to go to the hospital and how you will be treated when at the hospital.
Okay.
Now, typically, you would need to go to the hospital if mild symptoms of COVID-19 starts to worsen or don't gradually get better after using some of the tips Sri gave. Now, a good portion of the treatment/procedures are centered around ventilators. If the biggest problem of COVID-19, breathing problems, comes into play.
Gotcha.
I guess this Halloween, people are instead going to say, trick or treatment. But jokes aside, ventilators aren't the little machines that put a mask over your face attached to a tube to help breathing. Ventilators are actually machines that mechanically ventilate breathable air into and out of your lungs through a long tube that goes all the way through your throat and all the way to your lungs. Ventilators basically carry out the breathing function of your lungs when a disease makes the lungs' job breathing very difficult.
Okay.
Yeesh, all that talk about machines makes me shiver. Anyway, if you do start showing symptoms of the virus, I'll explain ways to lower the pain and hopefully slow the spread.
Okay.
Nasal congestion and a sore throat are common symptoms of the coronavirus.
Okay.
Gargle saline water for at least 5 minutes in the morning and try to use nasal sprays that are recommended by doctors.
Okay.
Try to avoid strenuous physical activity as a soreness period may be elongated with the virus in play. If you do feel discomfort in the body or in your stomach, try eating bland foods and drinking more liquids. Now, this next one may sound a bit cliche or weird, but it is true that lower anxiety levels help reduce lung scarring if you are infected. So use those breathing apps on your smartwatches and relax. You're at home binging TV anyway. It's not like you have 3 tests tomorrow or anything.
Yeah.
Try to schedule regular appointments with your doctor if symptoms do show up. But if anything escalates or if you contract a fever, do go to the hospital immediately and to make sure to follow the CDC guidelines to ensure a fast, speedy recovery.
Gotcha.
Okay.
Man, COVID-19 really gives us a lot of procedures to follow. Speaking of procedures, I still have some to talk about. The procedures I'll be talking about will help limit the risk of contracting COVID-19 and to limit spreading it to others if you do contract the coronavirus.
Got you.
Last episode, we went in depth on the transmission of this disease and a tad bit on how to limit transmission, and now I'm going to go more in depth on limiting infection.
Okay.
As we should all know by now, unless you've been going out to parties in highly populated areas, we should be social distancing from each other by at least 6 feet so the COVID-19 aerosols don't latch onto you. Other basics include washing your hands when touching something possibly contaminated and not touching your face. You know, basic sanitary stuff. Now, if you want to go the extra mile, which is in these conditions perfectly fine, whenever you go out and buy packaged food at the grocery store, you can sanitize the containers/boxes of those foods to further reduce the risk of getting infected. That's what my family usually does, and it works perfectly fine.
Me too.
Anyways, when around people more prone to the coronavirus per se, the elderly or those with a weak immune system, you want to social distance from them as well to reduce the risk of infecting them.
Got you.
Now, if you or a family member has COVID-19, always have the infected isolated in another room, and when handling food or items around them, wear masks and gloves at all times. Also, never reuse items to prevent infection, because if those items get contaminated and you still use them, it's like using your underwear again and again, which is super gross and unsanitary.
Yeah, that's true.
Overall, with all of those procedures in mind, you just want to be cautious and stay as sanitary as possible in order to stay safe and healthy.
Feel you, bro.
Okay. This is a lot to process. I think I want to stop here for this episode. Don't you think, Vamsi?
Yeah, let's save the rest for the next episode. Well, it's a wrap then, folks. Thank you, Dale and Sri, for presenting such valuable information in a digestible format.
Yep, no problem. Just doing what we can. Totally didn't take hours of labor.
Well, that wraps up our episode for today. We truly want to sincerely apologize to our listeners for the last 7 minutes of your precious, valuable lives that we wasted. Okay. Seriously though, but jokes aside, we truly appreciate each and every one of you who tune into our podcast every time. The more listeners we gain, the more this valuable information reaches other, and the more people it reaches, the happier and more accomplished we feel, and the more...
Yeah, we get it. You're happy.
Okay, fine. I was just appreciating our listeners. But that wraps it up for today, I guess. Thanks for tuning in, and have a great day.